Hope your week is off to a good start. You're watching Arirang TV special coverage of COVID-19. I'm Min Son-hee. Now, it appears the worst is over with regard to the Itaewon outbreak, but given the reality that those who are in the area have yet to mark an end to the 2-week incubation period of the virus, authorities are urging those who are in the area and have yet to be tested to come forward. Now, we have more on that later on in the program, but first, here are the headlines with our Kwon So-ah and Noaram. Welcome.
Hi.
Hi.
So let's start on the domestic front. I understand we are starting the work week on a better note compared to last week.
Right, Sunny. Last week was really a crucial week when it comes to the detection of COVID-19 patients related to the biggest cluster infection here in the metropolitan area. But now the numbers are stabilizing. So let's take a closer look at our daily figures. We have 15 new cases as of 12 a.m. this Monday, and one more death, bringing the death toll to 263. While a little less than 900 people are still in quarantine, and more than 9,900 people have recovered, so almost 10,000. Now, if we go back to May 6th, we only had 2 new cases at that time, but that's also when the Yongin 66th patient was confirmed after clubbing in Itaewon early this month. So following that case, we had a rise to 12, and then on May 10th, we see that there has been a surge to the 30s after massive testing across the nation. And then we see a decline to the 20s, and now we are at 15 cases, so in the teens.
Well, it's definitely comforting to see this downward trend. What is the government's assessment of the Itaewon case?
Well, authorities believe the cluster infection from Itaewon can be controlled and managed while maintaining the everyday social distancing measures, as new daily cases have been in their teens for 3 straight days now. Now, at the earlier government briefing, senior health official Yoon Tae-ho said the Itaewon case has not resulted in a dramatic spread and the numbers are gradually stabilizing. Yoon mentioned around 65,000 COVID-19 tests in relation to the Itaewon outbreak have been conducted, with a total of 168 people confirmed to be linked to that infection. Now, what remains a concern is the so-called silent spreaders, as some who have been in the Itaewon region between late April and early May have not gone to screenings. And another concern are secondary, tertiary, and even quaternary infections. There have been 89 cases directly linked to the clubs and bars the first spreader went to, while 79 cases have been identified as secondary to quaternary transmissions. Meanwhile, to curb the spread, health and quarantine officials have been busy over the weekend inspecting some 25,000 high-risk facilities, such as places of worship and singing rooms. Administrative orders have been implemented on 128 that have not abided by government guidelines, such as regarding mask wearing and keeping a log of visitors. But then on the other hand, there were some churches which have been praised for thoroughly checking service goers through creative means, like using barcodes at entrances.
Well, that's good to hear. On the international front, the U.S. has seen more than 90,000 COVID-19 related deaths, and Russia is second behind the U.S. in the number of total cases, I understand.
Exactly. Well, the U.S. has been recording more cases and fatalities than any other country in the world, and now it has more than 90,000 deaths and over 1.5 million total infections. And that's the number as of Sunday, when the country also confirmed 1,592 daily deaths. A dozen of forecasting models expect the U.S. death toll to surpass 100,000 by June 1st, although figures are rising at slower speeds in many parts now. On Sunday, U.S. President Donald Trump tweeted the country is doing, quote, really well medically on solving the coronavirus situation. Now, Russia, which currently is the second most affected country when it comes to total infections, though with a relatively low mortality rate, reported more than 9,700 new cases on Sunday, bringing the total to over 281,000. Russia now also has the world's second fastest rate of new infections.
And I hear there are new highs in India and Egypt.
Yes, India has extended its lockdown for another 2 weeks, and that as the virus is far from being contained. It's the fourth extension, now dubbed local lockdown 4.0. The move comes as India has recorded the largest single-day surge in cases of almost 5,000 on Sunday. 120 people were confirmed dead, bringing the death toll to above 2,800. The recovery rate stands at around 38%, with 34,000 people cured. The country's schools, public transportation, and most businesses are to remain closed for the time being. And a new daily record was also broken in Egypt on Sunday, with 510 new cases and a total accumulation of over 12,200. 18 new deaths were announced. But a new record was also observed in daily recoveries, as 222 patients were discharged from hospitals. Egypt, meanwhile, is currently under a nationwide 9-hour nighttime curfew from 9 p.m. to 6 a.m. during the month of Ramadan until May 23rd. And a quick overview of major outbreaks. So these are the countries all having cases above 100,000. And what's notable here is that Brazil has emerged as a hotspot, now surpassing Italy. And when we move over to our map, we have more than 4.8 million cases nationwide, worldwide, of course, and 1.85 million people have recovered, while the death toll stands at over 316,600, and that is as of 11 a.m. Korea time.
All right, so thank you for that. I'll come back to you after the regular briefing.
Thank you.
Meanwhile, Arirang, President Moon Jae-in is set to speak on the world stage regarding COVID-19.
That's right. His speech will go out to the World Health Assembly on Monday. That's Geneva time, so sometime around this afternoon here in Korea. He will be the first sitting South Korean president to do so. Now, former President Kim Dae-jung did actually give a speech before, but that was after his presidency. So Moon Jae-in will be the first sitting president to give the speech there. Now, this comes following a request from the WHO chief, who asked Moon to share South Korea's quarantine response to COVID-19, which has been widely praised around the world. Moon is also expected to stress Korea's 3 principles of quarantine, which are openness, transparency and democracy. He is also likely to call for stronger international cooperation against the pandemic. Now, the keynote speech will be pre-recorded, not live, and the gathering will be held via video conferencing, gathering hundreds of health ministers around the world. And now for Korea's representative health minister, Park Neung-hoo, will be participating in the conference.
Right, and the world's top health summit, I understand, is coming amid tensions between the US and China.
That's right, those tensions are likely to cast a cloud over the virtual meeting, which aims to work together on a solution for the pandemic. So those tensions will certainly hamper those efforts. Now, it's unclear whether they can agree on coordinated action or a direction for the containment effort during this height of the epidemic. Now, the two countries are widely divided in their positions on the origin of the virus and initial steps taken after the outbreak. Now, the US has also suspended funding to the WHO over allegations it initially downplayed the seriousness of the outbreak and was too cozy with China. That's the US's assertion. Now, another sticking point is Taiwan. Washington supports Taiwan's bid to join the Assembly, the World Health Assembly, while Beijing opposes the idea due to its stance that Taiwan is a part of China.
Right. Now, meanwhile, the WHO is downplaying concerns of contagion by touching infected surfaces.
That's right. Recently released WHO guidelines show that there's still no proof that people can catch the virus by touching surfaces where it lingers. Now, these include handles or keyboards or pretty much any surface that people may touch. But studies have shown that the virus can live for several days. Now, the WHO also cites a study showing the virus could survive on the outside of a face mask for up to a week. Now, although there have been no cases to date of people catching the virus from a surface, such transmission can't be ruled out given the behavior of other known coronaviruses as well. So the WHO is warning that these studies should be taken with a grain of salt, and these objects should also be disinfected and sterilized.
All right, Arirang, thank you for that. We'll see you again tomorrow. Up next, we have the regular afternoon briefing on COVID-19 here in Korea. Health officials are dismissing concerns that the Itaewon outbreak will trigger the next big wave of infections. This past Sunday, just 5 of the newly confirmed cases were linked to the area. Granted, within a span of 2 weeks, at least 168 people tested positive for the virus after the first Itaewon clubber case. Yet, given the rate of infection so far, the government is saying that this latest case in Itaewon Itaewon will not lead to a second wave of mass outbreaks. Now, health officials are nonetheless cautioning against decreasing compliance with safety precautions against possible infections. Members of the public are being advised to wear face masks, to practice good personal hygiene, and to avoid areas that are crowded and confined, especially if they are older than 65 or pregnant. Experts are also underscoring the reality that any containment of the contagion in the absence of a vaccine or cure, that is a fragile containment, and that people need to work together to maintain it. Meanwhile, education authorities are pushing ahead with their decision to start offline education for high school seniors this week, claiming that further disruption to the academic year may result in the young scholars' years of hard work going to waste. We are still waiting for the regular afternoon briefing, and while we wait, perhaps we can take a look at the figures for today with regard to the infections here in this part of the world. We understand there are 15 new cases as of early this Monday, raising Korea's total to 11,065. Now, just one person lost his life, raising our death total to 263. Here now is the afternoon briefing.
Let us now begin our regular briefing for the coronavirus outbreak here in the country. As of May 18th, today, we have 15 new cases, and the total number of confirmed cases now stands at 11,065. And 16 more people have been discharged, with a total of 9,904 being discharged, and we have a total of 898 people in quarantine undergoing treatment. We had one additional mortality, and we have the death toll standing at 263. And out of the 15 cases from yesterday, 10 were imported and 5 were community transmissions. As for the countries, from the foreign entrants, 3 from Americas, 1 from Europe, and 1 from UAE, and 1 from Japan, and 1 from Pakistan. And as for the 5 community transmissions, in relation to club, we had 2, and we have 2 cases of new infections in Chungbuk area, and 1 who was the contact of the already confirmed case in Daejeon. And also Daegu, and we also in Chungbuk we have confirmed that the sister of the younger sister was first confirmed and has spread the virus to her sister. And as for the club-related, 1 was the visitor and 1 was the contact who was working at the same office. And we had 2 more cases as of this noon, and making the total of club-related cases to 170. And 89 of them are visitors to the clubs, and the contacts are 81. And out of the visitors of the club, 1 has been confirmed to have gone to a nightlife entertainment venue in Gyeonggi-do area in Bucheon City. And on the May 9th, starting from the 11 o'clock p.m. This person has been visiting a nightclub there. So if you have been in the area during the same period of time, you should also get tested as soon as possible, and please consult with the public health center. We have a list of the entrants who were there at the same time, but it takes time for us to get in touch with you. So we advise you to voluntarily get tested. And we also advise that anyone who has visited any of the nightlife entertainment venues in Itaewon area, including any clubs or bars, from the 24th of April to May 6th, we ask you to stay home and refrain from going to other places, and contact a local health public center to get tested as soon as possible, regardless of your symptoms. And we also emphasize that those of you who are working in education, places of worship, indoor sports facilities, or other places that are prone to the virus, we ask you to get tested as soon as possible as well. well. And even if you test negative, it is still possible for you to have been infected, but in the 14-day incubation period before the virus activates, and therefore you need to strictly follow the self-quarantine protocol. And even if you are not subject to mandatory self-quarantine, you still have to minimize contact with others. We have seen a surge in the number of those who have been retested positive again, and as for mid-April, we have confirmed them as reconfirmed patients. However, based on experts' analysis, we have been revising and amending the guidelines for monitoring and for analyzing these retested cases. And we have been testing these viruses again, and there were no results or evidence to show that those who have been tested positive again are infectious. And we have carried out 285 testings on those who have been tested positive again, and they did not transfer the virus to others. And also the virus cultivation testings all on 108 people all tested negative. And also we have continued analysis and assessment of this, and we have to see that the contacts and those who have been tested positive again have no virus being cultivated, so that means that they do not have infectious power. Starting from the 19th of May, we will be revising our guidelines and protocols to diagnose these patients as confirmed cases again. And when we have this new guidelines, these will be also adopted to those who are on discharged from quarantine, and also this applied to those who have been discharged and returning back to their schools or offices. And when they are discharged, they will not go through the mandatory PCR testings anymore. And also we have been revising and amending the terminologies to describe these reconfirmed cases as well. We have seen a surge in the cluster infections among the community through enclosed spaces like the PC rooms and singing rooms and places of worship. So we advise you to refrain from having physical gatherings. And if you have to visit these areas, please have 2 meters of distance with each other. Please wear your face mask and keep your personal hygiene, like washing of your hands. And if you are in the high-risk group, including those who are over the age of 65 or pregnant or have chronic illnesses, please refrain from going to enclosed and crowded spaces. And when you have to visit these places, please wear your mask at all times. And as for the clubs and bars that are enclosed, if you have had contact with unspecified people, if you have symptoms like fever or other respiratory symptoms, you need to get screened and tested as soon as possible, and please consult the public health center. And if you have confirmed cases nearby you, you also need to get tested as soon as possible as well. And the quarantine authorities, together with the municipalities, we are trying to curb the further outbreak of the virus through the community transmission from the Itaewon club case. However, we believe that the coronavirus has infectious power even before showing symptoms, and also we believe that the virus can spread very fastly, even onto fourth hand of infections just within 10 days. And therefore, it is difficult for us to terminate the virus however, it is possible for us to control and manage the COVID-19. So this detainment or containment measure is a goal that we have been taking so far. Even though we cannot prevent all of the sporadic cases from happening, we believe that keeping personal hygiene, keeping distancing, and keeping the wearing of the face mask masks could help us in curbing the further outbreak and delaying the process and time of further infection. And we also ask the members of the public to participate in our quarantine measures. So please wear your face masks and please wash your hands on a routine basis. And please do not go to enclosed and crowded spaces like clubs or bars. And this could help us to prevent a mass infection. And the quarantine authorities going forward will expand our quarantine network, and together with a handful of experts, we will conduct analysis and assessment going forward, and we will exert our full efforts to curb the virus going forward. Thank you very much.
Right, there was Chung Kyung, the head of KCDC, with the latest briefing. So do give us an update of the key announcements.
All right, Chung announced as of 12 a.m. we had 10 imported cases and 5 community infections, which means now we have again more cases from abroad than these community spreads. And out of the community transmissions, 2 were related to the Itaewon clubbers case, which means that's a significant decline from what we've been seeing last week. But as of noon, 2 people have been added to that list, which means now the total number of Itaewon-related cases stands at 170, and 89 were visitors of these clubs and bars, while 81 were other contacts. So that number is now similar, which means, again, we have to be careful of secondary, tertiary, and even quaternary infections now. And Chung Eun-kyung, the KCDC chief, also made a really important announcement regarding relapse cases, as there has been made a change to the guidelines or protocol related to these cases where people tested again positive after being discharged from hospital. Now it looks like there was no evidence found that people who confirmed positive after being discharged pose risk of infection to other people. So that is good news there.
Right, okay, so thank you for that. We'll see you again tomorrow.
My pleasure.
The tracing of all of those who had been in Seoul's Itaewon area between late April and early May began right after the first confirmed case. In this next video, we take a look at how authorities were able to draft a list of these individuals.
해당 기간 내 이태원 인근에 계셨던 분들은 총 1,905명이었습니다. 그래서 전원에게 이미 문자 메시지를 발송했습니다. 어제 오늘에 걸쳐 기지국 접촉자 명단 전체를 확보했습니다. 감염병과의 싸움은 속도전입니다.
Meanwhile, in Germany, an expert there has calculated a way to monitor the spread of COVID-19 by estimating reproduction numbers over time. I have live on the line Professor Thomas Hortz from Ilmenau University in Germany. Hello, Professor.
Good afternoon, Ms. Min.
Let's begin, Professor, with the situation in Germany where lockdown measures have been eased. How is the public responding, and what is the course of the contagion there right now?
Well, the population, of course, has rejoiced to a certain extent. They can go to the hairdressers again, although I must admit I haven't got an appointment yet, as you can see. But people go to restaurants again, they go to parks, they go out more into the cities. We can see that there are also some protests taking place which are allowed again against some of the measures. But so far, people behave still responsibly. So, for example, few people go inside of restaurants or have been going at the weekend, but we're only sitting outside. So the reproduction number is not as much up as we had feared. It's still below 1. So the epidemic is still not spreading.
I see. Professor, do tell us a bit about your research on the basic reproduction number and how that can be used to fight the pandemic.
The reproduction number is the number of secondary cases that a primary case infects on average. And whereas the number of incidences, the number of new cases per day tells you about the speed of this epidemic's spread, the reproduction number in some sense tells you about its acceleration. So if the reproduction number is above 1, you can conclude that the epidemic is spreading at an exponential growth rate, which of course has dramatic effects. If it's below 1, it's being contained. So knowing this number is essential for monitoring the spread of the disease.
Professor, reports claim that the number of COVID-19 cases have been on the rise in Germany following the ease in lockdown measures. How do you interpret this?
Well, the numbers have been increasing because more people go out, as I said, go to the restaurants, meet more people again. You're now allowed to meet up with 5 people or with 2 households, depending on where you live exactly. So, of course, there are more contacts, and with more contacts, there's also more spreading of the disease. But still, it's not above 1, the reproduction number, so it's still not increasing exponentially. What we've been seeing are quite a few cases of people that work in slaughterhouses where living conditions are rather cramped, and so the virus could spread easily within the workers' communions.
Professor Hortz, Korea too is witnessing a rise in cluster infections following its transition from stringent social distancing to eased daily life quarantine guidelines. Based on the studies that you've conducted so far, are there any words of advice that you'd like to share with us?
Oh, I shouldn't really, given that we have 20 times as many cases per 100,000 people. Maybe us giving you advice is not quite the right thing to do. Of course, the countries are quite different culturally and socially, so the strict tracing measures that you have in place probably could not be imposed in Germany. This would lead to considerable protests, I presume, but I must say that you're doing rather well.
All right, Professor, thank you very much for making the time and for sharing your thoughts with us live at this hour.
My pleasure. Thank you.
어제 용인 지역에서 확인된 29세 확진자의 접촉자를 조사하는 과정에서 클럽에서 접촉한 12명의 확진이 확인되었고
진단이 늦어지고 시간이 지체될수록 2, 3차 전파로 확산되어 피해가 커질 수 있습니다.
Seoul's Itaewon outbreak has given rise to yet another concern amid the COVID pandemic: nightlife entertainment venues and the young who visit these establishments. For more on this reality, I have Professor Kim Kyung-woo from Inje University Seoul Paek Hospital, that is. Welcome to the program, Professor Kim.
Thank you for having me.
And I also have Anne Elizabeth Baby, freelance journalist from US News and World Report. Good to see you again, Anne.
Thanks for having me.
Professor, we'll start with you. What are your thoughts on the recent outbreak in Seoul's Itaewon district?
Yes, the government should re-evaluate current disease prevention and quarantine measure again. First, mostly the effective and feasible quarantine measures were not implemented in the places with a high risk of spread, such as bars, clubs, and karaoke singing room, and after-school private academies. And second, it was not satisfactory to take the whole contact information of visitors for rapid contact tracing and isolation. And third, rapid double checks were delayed in case that if the infected person hide their contact, we cannot cannot isolate the contact. So we should recheck the contact of the infected person more rapidly. But in these outbreaks, we also witnessed the hope through two church cases in Incheon that if all the community people participate in and practice small and basic quarantine hygiene measures such as wearing face masks and hand hygiene and distancing can prevent the spread of the virus in worship in Sunday. So in conclusion, the government should make more detailed and stratified guidelines according to the places, the risk of spread classification.
Anne, what are your thoughts on the latest outbreak in Itaewon? And do you think the government should perhaps strengthen its quarantine measures in light of this outbreak?
Well, for me, and I think for many others, it was rather unsurprising that something like this would happen. As we mentioned, these places are very crowded. They're not enforcing social distancing. People are not wearing masks. So it more seemed to be a matter of time as to when something like this would take place. But I do think that the government has kind of done a good job with the contact tracing, the mass testing. This scenario really put them to the test, and they've seemed pretty effective.
Professor Kim, this is not the first time that we've confirmed a COVID-19 case in a nightclub. We had another case in Busan. What is the difference between the case in Itaewon and that in Busan?
The big difference might be the infectivity of the infected person according to the disease course. In Busan case, he visited Busan club when he has a low viral load with a low viral infectivity. After he visited the club, he developed symptoms 3 days later, and 2 more days later, he was found positive when he get the military enlistment routine test. In Itaewon club, he had the club on 2nd of May, and he developed his symptom on the same day. So when the viral load is very high, just before the symptom developed. So the people at club were exposed in very closed indoor space without protection, such as the masks, and that caused this big outbreak in Itaewon club.
And you just also mentioned this, but many of the young here are also facing criticism for frequenting nightlife establishments without wearing face masks. Is this situation the same in the US, would you say?
Well, the US, by and large, the nightclubs and the bars are not open yet. But since there is no federal order for social distancing anymore, it's really up to individual states to decide what is safe for their residents. So there have been a number of states where the governors have reopened bars, like in Alaska, Alabama, Mississippi, Louisiana. And so in those cases, I guess we have yet to see what the effects will be. But in Wisconsin, for example, there was an interesting scenario there where the governor, who is a Democrat, had ordered stay-at-home guidelines, but then the Supreme Court in Wisconsin, which is a conservative Supreme Court, they struck down that order. And so then the bars were kind of opened immediately, and a lot of people rushed to go inside. So we'll see if other states kind of follow suit in that action. But as for nightclubs, the only state, I believe, that has its nightclubs open is Oklahoma.
Do you believe that young people are taking a rather lax approach, perhaps, to safety precautions in light of COVID-19?
I mean, I think this is a phenomena that spans countries and cultures where young people kind of have this attitude of being immortal or just young and healthy, and so this doesn't affect them. So we saw lots of pictures in the US, for example, where young people were crowding out onto like piers or beaches or parks, not following guidelines, especially over spring break, where a lot of them wanted to be on holiday and party and have fun. But I think there is a shifting attitude right now because we are seeing more cases that are more severe among adolescents and kids. So there is a rising concern there.
Right. Professor Kim, what is the proportion of young people in the total number of COVID-19 cases?
If exposed, the possibility of being infected will be same regardless of age or gender. In Korea, the current infection rate among the young people with their 20s is highest in compared with other age group, twice more higher than other age group. 45% per 100,000 people, the infection rate in 20s. And on the other hand, there is no mortality case reported among the in 20s in Korea now, in compared with 25% mortality in 80s and 10% mortality in 70s. However, even in their 20s, people with underlying disease are still at risk. And young people might suffer severe form of disease, so-called cytokine storm, simply immune overreaction. And the most big problem for young people infection, he or she can spread the infection to those who is more closest to him or her, like family. So that will be the problem.
Of course. Now, in this next video, we get another expert's take on some facts about COVID-19.
COVID-19 is known to cause a variety of symptoms, aside from fevers, coughing, and other respiratory signs of illness. UK Prime Minister Boris Johnson was seen with red, bloodshot eyes when he was infected with the novel coronavirus. Losses in one's sense of smell and taste have also been included in the South Korean government's new guidelines on the symptoms of COVID-19. If one experiences an impairment in their sense of smell and taste and develops bloodshot eyes, how worried should they be?
입맛을 잃거나 이제 냄새 못 맡으면 이제 코로나19를 먼저 의심하는데 사실은 보통 감기, 또 알레르기 비염, 또 눈에 이제 알레르기 안염, 결막염도 있을 수 있거든요. 그럴 때도 우리가 입맛을 잃고 또 냄새도 못 맡고 눈도 충혈되고 그러기 때문에 입맛을 잃거나 냄새 못 맡는다고 해서 반드시 코로나19는 아니다. 감기라든지 뭐 축농증이라든지 알레르기 비염의 한 증상일 수도 있다고 생각하시면 되겠습니다.
A number of reinfection cases have been reported among patients who were declared virus-free and released from quarantine, only to be retested positive for COVID-19. This has raised questions on whether dead virus fragments were detected in these cases, or if the diagnostic test kits themselves were flawed. So what are the factors that have contributed to the uptick in these recurring COVID-19 cases, and how contagious are they?
재양성 사례의 이제 상당수는 증상이 있어요. 미열이나 기침 재채기가 있기 때문에 죽은 바이러스라고 단정하기는 어려운 상황인 것 같습니다. 그런 경우는 바이러스를 억제하지 못해서 바이러스가 다시 활성화된 이 가능성도 있고요. 재양성 사례가 400여 명 이상인데 이분들을 아마도 이제 자가격리를 하고 있는 상황이고 2주 후에 이제 검사를 해서 음성이 되면 그때 해제가 되겠죠. 그래서 일단은 전염력은 상당히 낮거나 없다 이렇게 이제 판단을 하고 있고요.
코로나19 지역사회 감염 동향 그리고 면역도의 확인을 위한 효과적 방역대책 수립 목적으로 혈청학적 분석을 실시할 계획으로 있습니다.
South Korean authorities have announced a plan to conduct a nationwide test for COVID-19 antibodies. So why is it necessary to conduct such wide-scale testing?
항체가 생기면 이것이 코로나19에 걸렸다라는 하나의 증표입니다. 그러니까 증표이기 때문에 지금 우리가 PCR로 확진된 환자 수보다 항체 검사를 하면 더 많은 실제 감염자 수를 알게 됩니다. 그러니까 60 내지 70%의 집단 면역이 생기면 코로나19 유행이 종식으로 갈 수가 있기 때문에 이 항체 조사를 통해서 집단 면역 수준이 얼마가 있나 이것도 알 수가 있는 것이죠.
If that is the case, can people with antibodies freely go about without worrying about a possible infection?
면역 증명서라고 이제 얘기를 하고 있습니다. 근데 사실은 WHO도 그렇고 많은 전문가가 몸 안에 항체가 생겼다고 해서 그것이 반드시 예방하는 항체인지는 아직 확실하지 않다. 따라서 몸 안에 항체가 있다고 해서 그걸 면역 증명서라고 해서 그걸 갖고 다니면서 전 세계를 자유롭게 코로나19 유행과 무관하게 여행할 수 있는 증명서가 될 수는 없다. 아직까지는.
Silent transmission of the virus by asymptomatic patients and recurrent cases of COVID-19 are posing fresh challenges to the global community in the ongoing battle against the pandemic. Amid this backdrop, the role of individuals in practicing everyday quarantine measures has now become more important than ever before.
Professor Kim, I suppose what is more alarming is that more than a third of the confirmed patients in the Itaewon case had no symptoms.
Yes, it might be the difference in severity and disease progression. The young people have a very mild symptom. The symptom itself is very subjective, and very mild symptom cannot be recognized by the young people. And another reason in this outbreak, the massive and aggressive tests, more than 60,000 tests were done in very earliest time, and in their very earliest period of infection before the symptom developed. So the early and many tests can show this asymptomatic infection in young people.
And surely you'd agree that patients who display no symptoms are pose, that is, perhaps a greater risk on the general public.
In young people itself, for the disease itself is not so dangerous to them, but asymptomatic and vague symptoms in older people will be more dangerous because we cannot find the disease early, and the disease progressed very severe form in later time. But the asymptomatic infection in young people is a risk in view of public quarantine because we cannot find the infected people, and silent spread to the many people with unintentionally and helplessly.
And what is the current state of COVID-19 testing in the US right now?
Well, it's incredibly complicated because there is no federal coordinated effort at testing. So it's really on a state-by-state basis, and even beyond that, a city-by-city or county-by-county or even hospital-by-hospital basis. So, I mean, essentially the same cities are competing for the same resources. And so some cities have an overabundance of them and other cities don't have enough. So for example, LA, Los Angeles, they have too many tests but not enough test takers. So what they did is they opted to make their testing free for everyone in their city regardless of symptoms. But other cities have a huge shortage of tests, and so people there cannot get tested. So some companies are stepping in, like our two major pharmacies, CVS and Walgreens. They have decided to offer free testing to people who do show symptoms. but it really depends on, where you live.
I see. Professor, I understand that some individuals who were infected and recovered later suffer from severe long-term health repercussions. Please tell us more about this.
Yes, this new virus have just started for 5 months ago, so we cannot tell for sure about lifelong side effect now. But first, virus infection can damage many organs, not only respiratory system, lungs, but also cardiovascular, heart and blood vessels, and liver and neurological system. That can be some complications. And depending on the disease severity, several very invasive tests and treatment was done to the people, such as mechanical ventilation and ECMO. That can be very invasive. And third, the most people in severe status admitted in the isolation room in the hospital more than 4 weeks. Not only muscle loss, cardiovascular dysfunction, but also psychological distress, such as depression or psychological trauma, and long period of social isolation might make it difficult to come back to previous their routine social activities.
I see. So the best thing we could do is to make sure that this infection is controlled and that nobody is infected anymore. Right. All right, Professor, thank you so much for your thoughts. And Anne, once again, thank you very much for being here.
Thank you.
And that is all the time we have for today. Do join us tomorrow at this hour for more on the dangers posed by an infodemic amid COVID-19, where an overabundance of information, some of which are false, may aggravate public health. In the meantime, do reach out to us with your thoughts and inquiries on our social media accounts or our homepage, arirang.com. Thank you for watching.